Now, one thing I was going to check on from last time that you were here, I know the shoulder itself had been doing a lot better.
Yeah.
But the neck was a little bit tighter.
Mhm.
So how has that been since last visit?
I think that I'm wondering about my neck, like right here,
Okay.
and then it seems like something with this lat.
Okay. How has the overall, say the reason in terms of coming in at this area and here, how has that pain been?
Oh, it's so much better.
Okay, so no
Yeah.
restrictions with working out?
Mm-mm.
Okay, good. Yeah. Let me know as I'm pushing too, if anything's super painful at all.
Okay.
I know in terms of treatments, this is gonna be the 9th of 16.
Mm-hmm.
And so,
I think I do
yeah.
once a week next month, right?
I can double check for you, but most likely, yeah. So right in there.
Yeah, that's
Yeah.
spicy.
A lot of times you can see easily when we look for these guys, it's as simple as pushing, okay? They're really pretty easy to find. So, now is this radiating into the chest wall at all?
Mm-mm.
Okay, good. Yeah, and you can even see sometimes as we find the, say in terms of a muscle belly here, you can even see the movement up there, so, which is why a lot of times when we have discomfort there, it can cause headaches and all kinds of other things, so. And then, okay, I'm gonna go ahead and move this right here too.
Okay.
Yeah, like right there.
Oh,
It's
yeah.
a real easy one, you can see that there too. So, okay, perfect. Now, Carrie, if you were to tell people in terms of discomfort with the injections, how painful are the injections themselves?
Yeah, they don't hurt at all.
Okay.
That I think when you use the spray, it just feels cold.
Yeah.
And then you can kind of feel a tiny bit of pressure, but that's it.
Good.
I know that it was like intimidating for me at first, being like, oh my gosh, that's my neck. But then I don't really feel anything.
Good. It makes a difference too. I mean, the spray definitely helps, but obviously there's a lot of different techniques with this kind of treatment. And with it, you know, the technique I think determines how much discomfort you have. But in truth, most folks actually will feel almost immediate relief at times, especially as areas will release. Some areas will bruise at times, but the bruising, if you've had it, which I don't think you've had very much bruising.
I think one spot was just a little tender, kind of felt like a bruise, but there was no actual visible marking. And that was like 1 out of, you said this is my 9th one, so I don't even, how many injections would that be?
We
Something
usually,
like,
yeah, depending on the treatment, we'll usually do between 4 to 6 spots when we treat. So, you know, 4 times or 6 times 9, I mean, that's a pretty significant amount to have only one area of bruising in that time frame too, so. Now, I know in terms of workouts, any restrictions at all because of discomfort? Good.
I didn't even realize how much it was bothering me until I started coming regularly, and now I can just, my range of motion with my neck is so much better, my shoulder feels so much better.
And sleep?
Oh yeah, and that was the other thing with this sleep. That's so much better, and the fact that you guys gave me kind of the little guidelines of how to sleep properly, how I was laying, that's really helped too.
And that's part of the whole goal of while folks are here. Not only are we trying to do things that give immediate relief, we're trying to look at more long-term and teaching you ways to actually stay better, which is really important. It's not all that complicated always, but definitely can make a big difference just with sleep hygiene.
Yeah, I mean, well, we talked about it ever since I had my son. I've just kind of morphed into a stomach sleeper. So that is so helpful for me to try and sleep on my side more. And now I've even been trying to sleep on my back, which I thought was going to be impossible, but it's not.
Good.
It's not impossible.
And I think anybody can vouch, if you can sleep better, you're gonna feel better in a multitude of ways, so. Good.
It's just, I didn't realize how much this bothered me even when it, quote, wasn't hurting.
Well, our body has a pretty amazing design, the good and the bad of that is all these areas, whether we're just working here, there's connection to the rest of the spine. And all of these areas, especially from a nerve perspective, there's so much that this area controls. And so you don't really realize the impact that you potentially are having by not treating or managing it well. So definitely the improvement should be more than just local for sure. Almost done. Now usually next steps after we do the injections here, our patients will go and do an even more focused deep tissue massage with our massage therapist. And there's usually some physical therapy involved as well, which is really spine centered. And even when folks come in with more of a, say like a regular joint concern outside of the spine, you'd be surprised how much there's some spine involvement as well. So it usually gives folks a lot of relief because it's things that even if they've tried physical therapy before, they haven't necessarily done the things that we have folks do here. So
I think that that's the best part. It's not a series of appointments. It's just one appointment.
Yeah, exactly. It's nice to have everything under one roof. So there's really good movement on that one today.
Yeah, it was like a giant blocked ball last time.
It's a technical medical
term,
that
right?
is
a technical term. Locked up, not.
I always joke in medicine anyways, 9 times out of 10, the names for things, we just name things, fancy Latin terms so that we feel smarter. So.
We can talk in code.
Yep, it's speaking in code. Yeah, and you can see with the procedure that we do, there's really minimal bleeding. Though we're obviously inflicting some intentional trauma, it's really not terrible. And these types of procedures are done in a couple different measures. They're done sometimes at different primary care offices. They're done at, most commonly with neurology, and then secondly with pain management. But the thing that we do differently here also is we don't use any corticosteroids or cortisone. With our injections, we really feel that for one, it's not worth the risk and the systemic side effects, so we definitely use more natural medicine here. And so the medicine that we're using in Carrie's injections is actually called Serapin. So it's a natural botanical that chemically has properties of both anti-inflammatories and pain relievers, but it actually has properties that encourage actual healing of the muscle as well. And so we're kind of, inflicting a bit of trauma to get the process started, and then the medication itself then takes over. And it has really limited to no side effects, and we see it work really well here. So. Doing okay there?
Mm-hmm. The other thing I remember when we were going over the consent form and whatnot, like some of the, like you said, with you guys being so experienced, a lot of the potential things that could happen or the potential risks are just like really down to nothing.
Yeah, very much so. In the beginning when these procedures started, oftentimes in terms of length of needle, they were using sometimes even up to 1 to 1.5 to 2 inch needles, which really isn't necessary, especially if you have decent technique. And so because of that, there's a lot more risks. And so thankfully there's ways we just modify how we work that mitigate a lot of the potential risks. So yeah, probably the greatest risk, with any kind of injection is infection. And I can tell you in the time frame I've done this, I've not had a single issue. So. Good. You do okay today?
Yeah, it was great.
Yeah, good. Okay. Now, did you already work out this morning?
I did.
Okay, perfect. And that's the only other thing, say with treatments, depending on the area that we're working, let me get that for you. We do ask just that you would work out beforehand. You don't want to really stress the area after we worked on it and then cause some muscle tearing and so forth that you're not like, you know, we're trying to fix it, not make it worse. So, but she's been really good about that. So I know you did great.
Awesome.
Yeah.
Thank you.
I know. We're happy
I feel,
to
and
help.
it's so funny because I don't even notice you did anything when I stand up. Like you can't feel anything.
Well, and that's the joy too in terms of some of the medications that we use. You know, when you are in other environments and with different medications, you're going to have more issues and more side effects, and that's not how we work. You know, we're trying to functionally fix the issue. So
Yeah, the first one I remember being like, okay, I want to take a nap because I felt like I finally had some relief from all of that pain and like tension, and now I just kind of go about my day right after we leave. It's really awesome.